Hello, and welcome to the Badger Talks podcast, the podcast that shares interviews with experts from the University of Wisconsin-Madison community about their work, research, and a little bit about what they're like as people, too. I'm your host, Buzz Kemper. Today, we'll be talking about Riding in the Moment, a program involving horses, which was developed to improve the health and quality of life of people living with dementia and their families. And I'm happy to have as my guests Dr. Beth Fields, occupational therapist, assistant professor in the Department of Kinesiology, and affiliate faculty member in the Center for Aging Research and Education, and Wisconsin Alzheimer's Disease Research Center at the University of Wisconsin-Madison, and Jolie Hope, the Director of Three Gaits Therapeutic Horsemanship Center. Dr. Beth Fields, Beth, if I may, and Jolie Hope, thank you both very much for coming in. I'm really interested to hear about this program.
Yeah, thank you so much for the opportunity to be here.
You're welcome.
We're so excited. Thank you.
Yeah. So tell me about, you both have very different backgrounds. So I want to kind of start with that. The program is called Riding in the Moment, and I'm really interested to hear about how this impacts and how this sort of brings life back to the mind of people with dementia. I knew this a little bit about music because my father had dementia, and it was amazing how when the group would start singing songs, it was like they were 20 years ago. It's like they're back, and apparently that's what's happening here, and I can't wait to hear about it. But first I want to hear about a little bit about your backgrounds and how the two of you came together on this program. So Beth, I'll start with you.
Yeah, so I'm an occupational therapist and associate professor at UW-Madison, and I actually learned about this program when I moved out to Colorado for my graduate degree, and I started volunteering for Riding in the Moment at a center called Hearts and Horses in Loveland, Colorado, back in 2011.
Okay.
And
nice.
I wanted to start volunteering for that program because I had some family members who were going through dementia. And I really just wanted to learn as a clinician how to better interact with those folks.
Right.
So volunteering for this program, and it had just started that year, really opened up my eyes to exactly what you were just saying. The fact that these people would come alive when they got to the ranch and were interacting with the horses and the people around them. So after my volunteering experience, I decided to transition and get a research degree. And I approached one of my mentors at the time and I said, I think there's something here.
Yeah.
I think we need to study this. Because at the time, if you looked at the literature back around 2011, there weren't many studies at that point that were really focused on equine-assisted services and the dementia population and what the health or quality of life benefits could be. So I started just researching it through my dissertation. And then when I moved to Wisconsin, I reached out to various community partners, and I worked with the Community Academic Aging Research Network at UW-Madison to help me get connected with various aging and dementia groups throughout our state, and learned very quickly that a lot of our equine-assisted service centers weren't serving older adult populations, and many of them weren't serving the dementia population. So there was a local need. And at that point, I started partnering with Three Gaits because they're in Dane County. They're right there. I had a great connection with them through volunteering as well. And they had expressed interest right away and said, yes, this is something that our community needs. Let's figure out a way to make this program happen.
And the mention of Three Gaits brings us to Jolie Hope. What is your history with Three Gaits, and then what connected you with Beth?
I'm the executive director at Three Gaits, and I've been there only for about a year and a half now. The organization itself, though, has been serving the community for quite some time. It's been in Stoughton for about 43 years now. And throughout that time, the mission of the organization is to bring equine-assisted therapy and riding lessons to people with disabilities. And Beth said it very well when she said that throughout that time, we've tended to work more with people who were younger, younger to sort of early adults. And so this opportunity to expand our reach to the community and to work with older adults was something that was just an amazing opportunity. And we were so fortunate that Beth approached Three Gaits and brought this opportunity to us. So yeah, it's just a wonderful program.
So Three Gaits was, since you were working with younger people back then, you were, and I assume you still are, but since it was more exclusively younger people back then I assume that the disabilities you're dealing with were not dementia, but what were they? What were you specializing in with some of the younger clients?
So it's not really a specialization. It's really just a wide range of individuals. So so long as
mental disabilities, physical disabilities, all of the above.
All of the above. And really, so long as someone is able to ride, they're welcome at Three Gaits. And so we, either through therapeutic riding or through occupational physical therapy, they're integrated into our programs.
Now I want to come down. My older sister had horses when I was a kid, and so I actually learned to ride. And my sister, I hope she doesn't listen to these podcasts, but she had this mare who had an attitude, and the mare bucked me off. I'm on the horse, and then a tenth of a second later, I'm on my back looking up at the sky. And my sister's helpful remark was, "You shouldn't let her do that." Like, who let anybody do anything? So now I want to, I have a million questions. One thing I want to ask is there something special about horses? Would this work if the dementia patient was interacting with dogs or cats or I don't know, any kind of domesticated animal? Is there something particular about horses other than the fact that you can ride them, which you can't with a dog?
Well, I think that's a great question, and I think people have lots of different sort of guesses. So there's an idea that the horse's heartbeat, for example, will begin to mirror the heartbeat of the rider or the individuals around them, or different things like that. And I think really what it comes down to is that maybe we don't understand what it is about horses that is so special, but when you're around and you see this for yourself, there's no getting around the fact that it just has a tremendous impact on not only people with disabilities or dementia, but just really, I think, people in general. I mean, think about how long horses have been a part of our history and how important they've been. It's truly an amazing experience.
I bet. And Beth, do you have any reaction to that?
Yeah, I was just going to say, and I think that so there's a lot of literature that supports, interventions with other animals, like you had mentioned, dogs, especially with the dementia population. I think, too, what makes this type of program more unique is the experiential setting and all of the senses. So when you go out to a farm, you're not just getting the animal interaction, but you're getting those smells. You're getting, you're just getting so much more with the senses than you would if, like, you're bringing a dog into an assisted living facility, for example, for an intervention. And to Jolie's point, too, I think there's, this is going to sound very academic, but Wilson's biophilia hypothesis.
Oh, okay. No, that's okay. Let's unpack that.
This is me. I love it. But so one of the things in this biophilia hypothesis is that he asserts that, even when we're, young ages, like the symbolism that we see in fairy tales involve horses. So you mentioned, Jolie, the history of the horses in our country, and just like how they've helped, with farm work, and they've just touched people's lives in so many different ways, from like fairy tales to like work. So I think that's also a piece. And as a therapist too, there's a lot of literature that also indicates that the movement of the horse gait mimics a human pelvis. So if you have, a physical disability, it's also really helpful to get more repetition from the horse's gait when you're riding. It really works your core muscles and helps challenge and improve your endurance as well, compared to, other animals. You don't get that same experience.
Right. Yeah, exactly. You can't ride a dog.
Right.
Hopefully people aren't riding their dog.
And it's really fun. I mean, that's the other piece of it too, is that you're not in a sterile environment. You touched on just being outside in the sunshine and hearing the birds and having all those different experiences. And so you're doing something that has a true therapeutic value, but you're also having a lot of fun while you're doing it.
Yeah, I believe it. And so I imagine, now given that I know a little bit more about your background, that you are more focused on the sort of therapeutic aspects and what works and what doesn't work, whether it's a physical condition we're dealing with or something like dementia, and that you are dealing more with like the physicality of here's how you get on the horse and here and just horsemanship in general. Am I right about that?
Yeah, so this program, it is a standardized program. So we have a large and growing community academic team that has helped create manuals for centers to use, so that way the program is delivered as it was initially intended and has the same outcomes for everyone.
Okay.
Is the idea. So centers that decide to implement riding in the moment follow these manuals. And the thing about the manuals is there's safety considerations that are integrated in there.
Yeah,
so
I
centers like
touch
Three
on that.
Gaits
Yeah.
really make sure that they're following the industry standards, so that everyone, the activities are accessible, but no one has to worry about, an incident happening during a visit. And then I do more of the research piece.
And I want to touch on that research and the results, but let's jump to the safety aspect. So that is something that occurred to me right away, is that whether you're dealing with somebody who has some kind of physical limitation or dementia or something else, riding horses, totally healthy people can get injured riding horses. How do you deal with the safety aspect of it?
Well, there's a lot that goes into it. But the other thing to note is that you don't have to ride to be a part of the program. You can just come to the farm and be around the horses or groom them or just sort of be out in nature. So it's not a requirement.
Oh, okay. So some people maybe just brush the horses or pet the horses?
That's right.
Okay.
And on different days, they can choose to do what feels right to them on that day.
Okay.
But for safety, there's someone that is leading the horse, and then either a family member or a trained volunteer at Three Gaits will be walking beside the participant.
Okay, so the do we call them participants or patients? What's the proper term? What term should I use?
Participants. Yeah.
So the participants don't just get on the horse and take off and chase down the posse.
No,
like the Wild West. Okay.
No, that would be memorable, but no.
That would be, yeah, maybe not in a good way. But okay, yeah, because I'm just trying to imagine, how this plays out in practical terms. So.
Well, so because it's a therapeutic riding center, I mean, so our riding lessons are structured differently than like a traditional, like a hunter jumper lesson would be.
Okay.
We have a specialized mounting area that basically brings the person to the level of the horse, so it's very safe for them to get on. Like I said, we have trained riding instructors, and our volunteers also go through a wonderful training session that Beth and her lab helped to put together, so that they feel ready to help when they come to participate in riding in the moment.
Okay.
So they kind of have that core knowledge already, but it's just really sort of expanding upon that and learning how to make it the best experience possible for the people that are coming with dementia.
That makes a lot of sense. And yeah, when I hear that people are not only, riding the horses, but they also have the option of just interacting. I've always been an animal lover. And like I said, I grew up with the horses through my older sister. But you must have some amazing horses out there. These horses have to be not only, gentle and tolerant, but pretty smart.
They are. So we have 11 program horses, and you're right. They are not only specially trained, but they have just a very special disposition.
I bet. Yeah.
And you really get the sense that they like their job, that they're aware that there's kind of something bigger than themselves, that's taking place. Yeah, I mean, my family has horses, and all of our horses would fail miserably at this job if we tried to have them do that.
Okay, fair enough.
But no, it's a very careful kind of onboarding procedure, for lack of a better way of putting it, just to make sure that before they ever step foot in the arena, that they are ready, and that it'll be a safe, positive experience for everybody.
Yeah, and I think to some degree I tend to kind of anthropomorphize, but I remember taking some sort of remedial riding lessons about 5 years ago from a ranch near here, and there was this horse named Kane, and I remember I walked up to Kane and I petted him and I said, "I'm an idiot, you're going to have to help me." And we did this great riding lesson, and at the end I told the woman who owned the horse, I said, this horse was amazing. Like, if I gave him conflicting commands, he would do the thing I wanted him to do and ignore the thing that was wrong. She says, "I can tell he really likes you." Mm-hmm. And I thought, I wonder, did my talk, I know he didn't understand the words, but did I come across as humble, and that maybe meant something to the horse? I don't know, but that was an amazing experience. Now that we know a little bit about the process, let's go before and after with you, Beth, and talk about what was the research leading up to this, and I'd like to know a little bit about the results that you're seeing coming out of it.
Yeah, so like I said, this program has been around for quite some time in Colorado, but we've really been able to expand our data and research efforts within the last 5 years, thanks to partnerships and funding support that we've been able to secure. So some of the early studies, we really did more observational work where, like my dissertation, for example, we compared quality of life indicators, so people's apparent affect, how they were spending time, how they were participating in activities, and compared that experience of riding in the moment to daily activity situations in a long-term care facility. So think about music groups, arts and craft groups, television time, the typical things you would see when you walk into an assisted living facility. Right. And sure enough, we found better quality of life indicators during riding the moment than those in-facility activities. So that was really the first study that showed something's happening here. And since then, there's been, we have partners from across the country now that are part of our team that have expanded the research in different ways. I have a PhD student right now who's really interested in looking at whether or not this program improves sleep for participants with dementia as well as their caregivers. So we've recently started asking centers to ask their participants to complete this Pittsburgh Quality Sleep Index as one example. So we haven't looked at that data yet, but within the last year, we've started asking centers to collect more questionnaires than we did in the past. So right now, we've really shown that this program improves quality of life. But the goal is to also show that it helps improve balance. So centers are now starting to complete the timed up and go test, which is a common balance measure used in therapy. We're also interested in exploring differences related to caregiving burden. So a lot of the caregivers, so family members or friends of the participants, are coming with them to the visits, and they're also demonstrating and reporting favorable experiences from participating as well. So now we're starting to collect that data. So I'm really excited to start looking at that within the next year and get some publications out there with our team.
That's great. So you're noticing that there's more cognizant activity during the interaction with the horse, but there are longer term effects as well. Is there any research showing that this actually slows the progress of dementia?
We haven't done that yet.
Fair enough.
But we would love to find partners.
Yeah, okay.
You know, I think at UW-Madison, we have our Alzheimer's Disease Research Center and a lot of very well-trained, smart individuals in the dementia space who could look at, you know, like brain scans or could look at, you know, other physiological measures that we just haven't captured with this program, but we haven't done that yet. But
that would be a remarkable thing to know. Can this actually slow the progress or somehow at least change the trajectory in a positive way? That would be absolutely wonderful. Is there anything about the program that either of you would like to say, but I haven't asked the right question to get to?
That's a good question, Buzz.
Thank you.
I think that Beth was talking about sort of the quality of life, like for balance and for sleep. But there is the caregivers, responded to us at the end of each session saying that they found that their time at Three Gaits and riding in the moment would stay with them throughout the day and would stay with them for some period of time longer than other activities were, and just how much joy it would bring them. Like we created picture books for each of them at the end with their horses and with the volunteers and at the farm, and that caregivers would say that on a day that was maybe not the most positive day, that they could take that photo book out and it would bring joy to them again and again and again.
Yeah.
And that, there just are so many great stories. It just so quickly became one of our favorite days. And we were having to basically turn volunteers away because so many people wanted to participate.
So many people wanted to do it. Wow.
It's just...
that's a good problem to have.
You don't really realize, I think, in your day-to-day life how many people are affected by dementia. And that's something that we found at Three Gaits, was that so many of our volunteers or community members would say that they too, just like you said with your father, or Beth with you, with your loved one, that it had been a big part of their life. And so they were so happy to be a part of something that could bring joy.
Yeah.
We had one husband say that 6 days a week his wife didn't want to get out of bed, that it was difficult, it was challenging, but that on riding in the moment days, she'd beat him out of bed, she'd be dressed, and she'd be saying, "Come on."
Wow, yeah. Come on, I'm waiting for you.
It's time to go.
Wow. That's terrific.
There was a woman who was is a special part. She's going to be joining us again this year, who had early onset dementia, which is its own kind of scary thing, right, for our community. And as part of the development of the disease, she began to suffer more and more from aphasia. I'm not sure if suffer is the right term, but as part of her development of dementia. And she was really hesitant to ride the horse, but after time she became comfortable. And once she did, it's like the minute she climbed on, she became basically lucid. She was able to have conversations with people. She noticed things that were happening around her that just a few minutes before that she wasn't able to. So I know we all want to have scientific reasons for why things happen, but in that moment, there was something, to use your word from before, Buzz, almost surreal. You just knew you were a part of something special that was happening. Yeah,
a part of the brain just lights up.
It was a connection that happened between the horse and the rider. And when you have those moments at the farm, it's hard to not. I mean, I'm tearing up now. It's hard to not feel the impact of that when you see it for yourself. So.
And quickly, just what is aphasia, just for those who...
So I'm not a speech language pathologist, but, difficulty with communication.
Okay. Yeah. I mean, these rays of sunshine that we can give to people. What a wonderful program. Beth, anything that you can think of that you'd like to add?
Yeah, I mean, I think, first, and I recognize I haven't done this yet, but I'm so appreciative of the team that is behind this program, because that is really what has made it, sustainable. And it's now scaling across Wisconsin, which is great because, we have this ranching community in the state. So horses have touched so many people's lives in addition to dementia. So it's just it's this nice pairing. And I, am very grateful that we've secured funding through the Community Impact Grant Wisconsin Partnership Program, the School of Medicine and Public Health, because they were really the ones who helped bring this program to Dane County. We tried for several years reaching out to more federal or larger foundation grants, and granted, COVID was sprinkled in there too, and needing to social distance, and a lot of these centers had to shut down because of the distance or proximity and needing to distance for safety. But I'm so appreciative that the Wisconsin Partnership Program saw something in Riding in the Moment to bring it to Dane County, because it really, we get so many emails and calls from participants who are interested in joining.
Yeah.
And I think the powerful thing about this program, beyond just interactions with the horses and just being outside, is that it's tailored to the individual's abilities.
Right.
So it's a strength-based program.
Yeah.
And a lot of the current dementia care programs don't necessarily always feel that way. Especially when you're talking to caregivers. Caregivers will often just say like, oh, that program didn't really do it for my loved one because it made them feel like inferior, less than. It didn't really tap into like their past history or, occupations or whatever they enjoyed doing before the disease occurred. So I think that that's also one of the strengths of this program, is that before they even start, they complete an intake packet that the volunteers and the staff use each week to tailor those activities and figure out, okay, what is this participant going to enjoy doing? Like, do they want to go on a nature walk and talk about birds while the horses are in the background? And that's fine if that's what they choose to do. So as Jolie mentioned, it's not just about the riding. It's really just about coming together in this unique community space and allowing people to do the things they love and want to do.
Yeah. Just being in touch with nature and animals and the farm. Yeah, that's great. Thank you both so much. And before I let you go, I'd just like to, and I'll start with you, Jolie. What do you do in your spare time? Do you go out and ride horses? Do you have other sports that you do, or what do you do in your spare time?
I'm a mom of 3, so there's not a ton of spare time in my life.
I've heard that children require some time.
They do, but we have horses. I ride myself.
Okay.
So it's a huge part of my life, and it's something that has brought me joy that's hard to even put into words. So I love to garden. I love to cook. I really love exploring around Madison. So
cool. All right. Good deal. And what about you, Beth?
Yeah. Also going to be a mom too here soon.
You have one now?
I have a 4-year-old.
Okay.
And the second daughter is on the way here shortly.
Okay. And you have a negative few-month-old. And, okay. Fair enough.
So that also consumes most of my time. But
I bet.
Madison, just like living in Madison, there's so many outdoor things that I just like absolutely love. We moved here we actually lived in Pittsburgh before. Okay. So very industrial city feel. So coming back to Madison I love the lake life. Yeah. I love the trails. I want to get Everly into riding at Three Gaits when she's like old enough. Those things.
Yeah. And I was going to ask you, Jolie, speaking of that, can people just sign up to ride at Three Gaits? How open is it?
Well, Three Gaits, we work with wonderful people with all different types of disabilities.
Okay.
So really, anyone that would fall in that realm, have a diagnosis, is welcome at the farm.
But someone with no disabilities, or at least like me, no discernible disability, could I sign up to ride, or is that not a thing you do?
We don't have traditional riding lessons, but the thing I would say to that is that we have a huge need for volunteers.
Okay.
Like I mentioned before, for pretty much every participant that comes to our program, there are 3 volunteers that work with them in each and every lesson. Okay. So
it's a 3-to-1 ratio. Wow. Okay.
For most of our riders. So That experience, I think, is something that becomes a very special part of many of our community members' lives.
Yeah.
So the riding lessons are not there, but you still interact with horses. You're doing something that's sort of selfless and for the benefit of somebody else. And you're a part of this really great community. Yeah. Like I say, I think one of the best things about Three Gaits is kind of the soul and character that exists at the farm. It's just a place filled with joy, and it's really hard to find that sometimes. So I think that's one of the favorite parts of our instructors, our staff, our barn members, and our volunteers. It's just that they get to come there and know that it's going to be a good part of their day.
Yeah. Interacting with animals is such a wonderful part of my life. And I'll go up to Devil's Lake or go somewhere out west or something to go rock climbing. And, I have this great time climbing. But if a couple walks by with a dog, I'm just like, oh, there's a dog. I get to pet the dog. It's just amazing. Or if I get to interact with a horse or, it's a really wonderful
it's hard not
thing.
to smile when you come across an animal that, is going to mirror mirror how you're feeling.
Yeah.
And equally get excited.
Yeah, exactly. And they're excited to see you.
Yeah.
It's absolutely wonderful. Gosh, Beth, I would love to ask 20 more questions, but I think we covered most of it. Beth Fields, Jolie Hope, thank you both so much for doing this interview, but also for what you do. I mean, you're really, you're really making a difference for people's lives. So thanks.
Thanks for having us.
Yeah, thank you so much for helping us spread the word about this program.
Yeah, my pleasure. You've been listening to the Badger Talks podcast. I hope you enjoyed my conversation with Dr. Beth Fields and Jolie Hope. Please browse our previous episodes for other topics that may be of interest to you. The Badger Talks podcast is a creation of UW Connects and produced at Audio for the Arts Recording Studios in Madison, Wisconsin. Our music is composed by Bill Purdy and performed by the UW Marching Band. I'm Buzz Kemper. Thank you for listening.